Imagine this. You wake up one morning with a throbbing toothache. It's been building for weeks, maybe months. You know exactly what you need to do. You know there's a solution just one phone call away. But you don't make that call. Instead, you take a painkiller, distract yourself, and tell yourself, maybe tomorrow. If that sounds familiar, you're not alone. Studies estimate that between 36 and 40% of the global population experiences significant dental anxiety. And for roughly 12% of people, that anxiety is so severe it has a clinical name: dental phobia. Today, we're going to go deep into the psychology of why so many people avoid the dentist, sometimes for years, sometimes for decades, and what's really going on beneath the surface.
Let's start with the numbers because they're honestly staggering. In the United States alone, it's estimated that over 60 million people avoid the dentist due to fear. In the UK, surveys show that nearly 1 in 4 adults hasn't visited a dentist in over 2 years, not because of cost or access alone, but because of anxiety. In many countries, dentists report that a significant portion of their patients only show up when the pain becomes completely unbearable. By that point, what could have been a simple filling has turned into a root canal. What could have been a root canal now requires an extraction. The avoidance creates the very outcome people fear most. And yet, knowing this doesn't make it stop, because dental fear isn't really about logic. It's about something much deeper.
So, where does this fear actually start? For most people, it begins in childhood. Research consistently shows that a single traumatic dental experience before the age of 10 can create a fear response that lasts a lifetime. A dentist who was too rough, a procedure that hurt more than expected, being told to just sit still while feeling completely out of control. The brain, especially a child's brain, is remarkably efficient at storing danger signals. When something causes real pain or fear, the amygdala, the brain's alarm system, files it away permanently. Every future dental appointment becomes linked to that original threat. But childhood trauma isn't the only source. Vicarious learning plays a massive role. Many people develop dental fear without ever having a bad experience themselves, simply by watching a parent, sibling, or friend react with terror to dental treatment. Fear is contagious. Children absorb the emotional reactions of the adults around them, and those absorbed fears become their own. Then there's cultural messaging. Think about how dentists are portrayed in movies and television. From Little Shop of Horrors to Finding Nemo, the dentist chair is almost always a place of dread, pain, and helplessness. We've been culturally primed to fear it.
Here's something that most people don't consciously realize about dental anxiety. A huge part of it isn't actually about pain. It's about vulnerability. Think about the dental chair for a moment. You are lying back, mouth open, unable to speak, unable to easily see what's happening. A stranger's hands and metal instruments are inside your mouth, one of the most intimate and sensitive parts of your body. You have almost zero control over the situation. For human beings who are wired to assess and respond to threats, this setup is psychologically extreme. Psychologists call this loss of control, and it's one of the most powerful drivers of anxiety in any context. Studies on dental anxiety consistently find that patients aren't just afraid of pain, they're afraid of not being able to stop the pain if it happens. That distinction is crucial. This is also why dental anxiety is especially common in people who have experienced other situations where they felt powerless, difficult medical histories, trauma, or even just a personality that's naturally high in the need for control. The mouth is deeply personal. It's connected to speech, to eating, to intimacy, to identity. Having it worked on by someone else while you lie there unable to communicate clearly, that triggers something primal.
Now let's talk about something that makes dental fear even more complicated and far harder to overcome: shame. Here's how the cycle works. A person avoids the dentist because of fear. Time passes, months, then years. Their teeth deteriorate. Now, when they finally consider going back, they face a second layer of fear. What will the dentist think of me? They imagine judgment, criticism, disgust. They imagine the dentist or hygienist saying something humiliating about the state of their teeth. And so, they avoid even longer. The shame of dental neglect is one of the most underappreciated barriers to treatment. Patients frequently report that the embarrassment of their oral condition is now greater than their fear of the procedure itself. They'd rather endure ongoing pain than face that perceived judgment. This shame is compounded by the cultural narrative that good teeth are a sign of discipline, cleanliness, and self-respect. When teeth suffer, people feel it reflects something deeply wrong with them, not just their dental history. Dentists who understand this, who actively communicate non-judgment, warmth, and compassion, see dramatically different outcomes with anxious patients.
By now you might be wondering, why can't anxious people just reason their way out of this? They know the dentist is trying to help. They know avoiding makes things worse. So why doesn't logic win? Because when the threat response activates, the rational brain goes offline. When an anxious patient sits in the waiting room or hears the sound of the drill, their body enters a state of fight, flight, or freeze. The sympathetic nervous system floods the body with adrenaline and cortisol. Heart rate increases, breathing becomes shallow. The prefrontal cortex, the part of the brain responsible for reasoning and decision-making, loses influence. In that state, a person literally cannot think their way calm. Their body has decided there is danger, and it is responding accordingly. This is why people cancel appointments at the last minute, even after promising themselves they'd go. This is why they sit in parking lots for 30 minutes and then drive home. The rational intention and the emotional brain are in direct conflict, and in acute anxiety, the emotional brain almost always wins.
The good news is that dental anxiety is one of the most treatable forms of anxiety, and the dental profession has made enormous strides in addressing it. Communication and informed consent are enormously powerful. Simply explaining every step before it happens, telling a patient, "You'll feel a small pressure now," instead of just proceeding, dramatically reduces anxiety. It restores a sense of control. Establishing a stop signal, like raising a hand to pause treatment at any time, changes the psychological dynamic entirely. Suddenly, the patient isn't trapped. They have agency, and that alone reduces fear. Gradual exposure, starting with short, low-intensity appointments just to build familiarity and trust, helps retrain the brain's threat response over time. For more severe cases, therapies like cognitive behavioral therapy, EMDR, and in clinical settings, conscious sedation have proven highly effective. And perhaps most importantly, finding a dentist who listens. Patients consistently report that a compassionate, unhurried dentist who acknowledges their fear without dismissing it is the single biggest factor in whether they return for care.
Dental fear is real. It is not weakness. It is not irrationality. It is the brain doing exactly what it was designed to do, protecting you from perceived danger based on everything it has learned. But the cost of avoidance is high, not just in terms of oral health, but in quality of life. The confidence to smile, to eat without pain, to stop carrying the quiet burden of a problem you've been putting off for years. If you recognize yourself in any part of this video, know that you are in very good company, and know that it is possible to change your relationship with dental care, one small, gentle step at a time. Thanks for watching. If this resonated with you, share it with someone who needs to hear it.